Hello everyone, my name is Johannes and I'm a fourth year undergraduate student studying biochemistry, and the neurological disorder we'll be discussing today is cerebral palsy. Real quick, this channel aims to discuss autoimmune and neurological disorders in an easy to understand manner. It could quite literally take weeks to cover each one of these conditions in its entirety, but hopefully we could break them down to their fundamental parts. Now, according to the CDC, cerebral palsy, or CP for short, is the most common motor disability diagnosed in childhood, occurring in about 1 in every 345 children. Although there's no known cure for CP, fortunately it is non-progressive, meaning that it does not get worse over time. This means as soon as you get the disorder assessed, individuals can begin to improve their abilities. So what is cerebral palsy? Cerebral palsy is an umbrella term used to discuss a neuromuscular disorder that affects the motor functions of an individual. CP is caused when the brain of a child does not receive the sufficient amount of oxygen in the womb or shortly after birth that affects the development of the brain. This is known as brain hypoxia, and events such as stroke, pneumonia, or an umbilical cord defect can all be some causes of CP. Now, there are 3 different types of cerebral palsy depending on which area of the brain was affected. We'll start off with the most common form of CP, known as spastic cerebral palsy. Spastic CP affects around 80% of the people diagnosed with CP, and it is primarily due to injury on the motor cortex of the brain. Spastic CP is characterized by continuous muscle stiffness, spasms, and involuntary contractions, which can be painful. A person with CP may find it difficult to walk or perform certain tasks, and as they grow, they may have deformities in the individual's bone structure. Next, we have dyskinetic cerebral palsy. Dyskinetic CP is characterized by involuntary movements and a lack of coordination and balance. The muscle tone in individuals with dyskinetic CP is oftentimes too tight or too loose, and they can also have twisting and abrupt movements. Dyskinetic CP results from the injury of the part of the brain called the basal ganglia. Lastly, we have ataxic cerebral palsy. The name comes from the word ataxia, which means a lack of coordination and without order. Ataxic cerebral palsy is characterized by shaky or unsteady movements that appear and look clumsy. Ataxic CP affects around 5 to 10% of people diagnosed with CP and is caused by damage to the cerebellum. Cerebral palsy can also be classified by which limbs are being affected. For instance, if all 4 limbs are affected, this is known as quadriplegia. Oftentimes, the trunk, face, and mouth are also affected with this sort of CP. If 1 arm and 1 leg on the same side of the body is affected, this is known as hemiplegia. And if either both legs or arms are affected, this is known as diplegia. For instance, someone with CP would say, "I have diplegic spastic cerebral palsy," to further explain what type of CP they have to a medical provider or anyone to provide the best care for them. Early signs. Another early sign that shows in children with CP is the inability to roll over. Babies usually have the ability to do this around 4 months, so if they aren't able to do it around then, maybe it's time to just keep an eye out for anything. If the infant feels floppy, heavy, limp, or has tense legs, these are all signs that your child may need to be tested for CP. Diagnosis and treatments. There are several ways medical providers use to diagnose CP within young children. Several scans of the brain are taken to be viewed and analyzed to view brain activity. Medical providers use 3 different types of classification system tests to define the capability of the child. These tests are gross motor classification system, the manual ability classification system, and the communication function system. So what are some treatments and plans we use to help people with cerebral palsy live a long and healthy life? As stated previously, there is no cure for CP, but there are several forms of medication that can alleviate pain and muscle soreness. Physical therapy can also be utilized to help the individual gain the skills to maximize their independence to live a long, healthy life. Surgery is used as well to help alleviate pain and help correct some muscular deformities. And there you have it. Thank you so much for watching the video, and if you have any questions, feel free to put them in the comments below. And as always, take care.